Medical professionals of Reddit, when did you have to tell a patient I've seen it all before to comfort them, but really you had never seen something so bad, or of that nature? Years ago my then 11-year-old shattered both femurs and her hip. At the time, her orthopedic specialist was so reassuring and confident that we had no doubts about her recovery. A year later, we went back for a review and he asked me if I'd like to see her trauma x-rays. Not having any idea of the reality, I said yes. What I saw looked like her leg bones had exploded. After my freaked out reaction, I commented on how cool and calm he was and how certain that she'd be fine. He said he'd actually had to go for a short walk around the hospital to collect his thoughts, since he had no idea how he would put this child back together. He also told me he'd use the films as a teaching aid. He's one of my heroes. Had a guy that shot himself under the chin with a shotgun. He had actually done it like 16 hours prior to family finding him. He was still alive, conscious, and alert to what was going on. His jaw looked like Predator. I had family freaking out, of course. Had to tell them we see worse often. Which may be true, but they are usually dead. He lived for almost a day after shooting himself, then died in the back of my ambulance. As a medical student doing my first placement in the emergency department, I was waiting outside the triage room to ask the nurse something. I was the lowest ranking, most clueless person in the department. I knew a lot about the Krebs cycle, not a whole lot about, medicine. A young man came up to me and said he was sorry to disturb me, he just wanted to check. It was just, well, not to queue jump or anything, but he wanted to check, can this definitely wait for triage? He then unwrapped a towel from his hand and showed me his thumb, which he had dropped a loaded barbell onto. It was shattered, just flattened, with splinters of bone coming out. I stared at it. He stared at it. I stared at it. Then I told him, oh yes, no problem at all. He'd better take a seat and I'd make sure someone was with him right away. Lady came in with possible stroke symptoms, numbness, weakness, difficulty speaking, gale abnormalities. Caught brain unremarkable. Lab work was really odd. We were thinking cancer, so we decided to court her chest and abdomen as well. Turns out she had a dissection the entire length of her abdominal aorta and going into her right femoral artery. Left femoral had an aneurysm and was beginning to dissect as well. She had formed a massive clot throughout her abdomen that was miraculously keeping her alive. Basically all of her organs were ischemic, dead. About 5 different teams showed up in the ER to see her. After hours of discussion, the consensus was that there wasn't a damn thing anyone could do. We sent her to hospice. Edit, Ellie5 in a comment below. Please don't give me any more gold or silver. Take that money and make a donation. If you don't know where to donate, consider American Foundation for Suicide Prevention. In 2011 I had a saddle pulmonary embolism 2 weeks before my scheduled wedding. My quite seasoned heart surgeon seemed pretty confident that I'd be okay, and he even said he'd get me to my wedding on time. Long story short, I was in the hospital for about a month due to complications. Several weeks later, when I was visiting my heart surgeon for a follow-up, he told me he'd only ever seen 2 other people as sick as I was. Those 2 didn't survive. Paramedic here. Had a homeless guy call saying he stepped on a nail about a year ago. I could smell it from the door, so I expected it to be bad, but when I went to pick up the leg by his heel there was just nothing there. His foot just evaporated into pus and maggots and his metatarsals clinked through my fingers. While I'm standing there trying to comprehend what happened, he just sighed and asked me to pick up his foot. What foot, buddy? Put it back on. He said it falls off a lot these days, but it still hurts, so that's good, right? I had no clue what to tell him. The nurses thought it was hilarious that the baby medic, that's me BTW, got grossed out. Honestly, it was usually when an alert, oriented person pooped themselves. Could have filled the bed and be running onto the floor. You still maintain that? No, don't worry, we do this every day. Now let's just get you clean. Alright. Facade. Edit 2. For clarification, I don't mean alert people who deliberately soil themselves or the bed. I mean alert, but ill or disabled in some way. They can't control the poop, and they're probably terribly embarrassed. When I was a med student on the trauma service, there was a gentleman who decided to attempt suicide using a shotgun aimed at his heart. Unfortunately, the first thing that comes out of a shotgun when it is fired is a gust of air, which changed where the gun barrel was pointed. When the shot came out, the shot pellets ended up hitting everything but his heart, lungs, ribs, spleen, stomach, liver, pancreas, and large and small intestines. The attending surgeon told me to put my hand on his beating heart, because that will likely be the only time in my medical career that I would touch a beating heart. I did. It was cool. In case anyone reads this in a thread with 1500 plus posts, he survived. Though, he was on the trauma service for the entire month I was there, and was in the hospital for a long time further. I had to have my leg rebuilt after a car accident, and was eventually sent to Duke University for my surgery. My surgeon was supposed to be like the best orthopedic surgeon in the country. I think he used to work for the Baltimore Ravens. Anyway, all the doctors from my hospital at home were very unsure if I would even have a functioning leg, let alone walk normal again. The first appointment at Duke, that dude told me it was really not a big deal and he would have me fixed almost good as new. I honestly thought he was just trying to be nice and optimistic, but he was very serious. 5 months later I was walking and learning how to run again. He said I was one of the most complicated surgeries he has had to do, and a group of surgeons flew in to observe him do it. Medical student here. Had a first-time mother who was having difficulty nursing because her nipples were chafing pretty bad from the baby teething / constant moisture to the area. Before showing me and her ob/Jin the problem, she apologized that I had to see it, probably because I'm male, but I told her I've seen plenty before, especially in the ear. While not the worst thing I've seen, gunshot to the head takes the cake. I don't think I've seen skin so badly chafed before, and it looked like she might have had the beginnings of mastitis on one of her breasts, since it was red, warm, and very tender. The nipples themselves just looked raw and extremely painful. Not even close to a medical professional, but my aunt is a nurse, and told me about a guy who came in coughing up blood and maggots, and it turned out to be some worms he got from eating something that ate through his stomach lining into his esophagus, and were in his throat. Not a medical professional, but I have impressed a couple. It's not super weird, but just uncommon I guess. I was overweight but active when I was younger, and broke my lowest rib while snowboarding. Long story short, I did not know it was broken, honestly, so I never got it checked by a doctor. The rib traveled up over the next 2 ribs, and has since fused to them. I now have a permanent tilt on my spine where this rib attaches to it, and now that I have lost some weight, a bump you can see/feel on my chest. It is kinda weird when you tell a doctor about something on your body and their face lights up like a kid on Christmas and they ask for permission to feel it. My aunt started her nursing career in a county hospital, which means you get all the homeless folks. A guy came in with the whole of the back of his leg and butt utterly and very deeply infested with maggots. He just hadn't gotten around to coming in earlier, he said. The depressing thing is that, while it was a first for my aunt, it was by no means the last. Apparently it's more common than you'd think. I'm a nurse, and I work in a pediatric ER. A young woman brought her baby in to be seen for vomiting. I asked her to put the baby on the scale. While on the scale I notice a strong odor of bug spray, so I asked about it. Mom, a roach crawled into her mouth, so I sprayed a little right in there. She said it matter-of-factly, like it was no big deal. Pick up calls to the police, CPS and a 1:1 sitter for the child and the mom. When all was said and done, the baby was fine and turned over to her grandmother, so no worries there. I have no idea what happened to the mother. I don't believe she was intending to hurt the child. I think she was just butt-ass ignorant. I worked as a mental health tech to get through undergrad. 15F in the adolescent ward claims to have swallowed a staple. But whatever, as I am taking her down to x-ray I tell her about the dime I swallowed when I was a kid. It happens. Well, turns out she underestimated the number of staples by around 100. Every printout given by the therapists had been a swallowed staple. She had gotten staples from the other kids. The x-ray of her abdomen looked as if it were a weird staple-Y snow globe. And yet, Somehow, she was back to trying to steal psych ward staples a week later. Never did figure out how they removed them all. I had to see an orthopedist oncologist because I had two sarcomas. One in my left thigh in the sciatic nerve, and one in my left pelvic. My surgeon said he would get both out, and the most I would get would be a drop foot, where you cannot lift up your foot on your own. I went back 2 years later, and my doctor told me he thought he would have to remove my leg because of how the sarcomas were enmeshed in my bones, muscle, and nerves. I honestly thought the whole time that it was an easy out, though the 2 10-hour surgeries may have been a clue that it was not so simple. These days I have a limp as I am missing half my left pelvic bone and most of my glute and thigh muscle, but I got to keep the leg. I'm a surgical tech. I got called in on a Saturday for a lady who had an infection from a component separation. Basically they put a giant piece of mesh in you for hernias. I was not prepared. When we lifted up her gown, the smell wafted, and I have never almost puked before until that moment. About 20 centimeter circle around her umbilicus was black and necrotic. It was absolutely awful. We basically removed the entirety of the necrotic tissue all the way down to the peritoneum. Just grey and black slimy mass of fat and skin. The worst part is that I had to measure the necrotic tissue, and it requires me to lean in a little close to it. The surgeon was laughing because I was green when I got back to the surgical field. Then during that surgery another person who had the same procedure had come to the ER with an infection. And then a third. We stopped using the mesh because that is what was getting infected.